None of the producers have any financial interest in the products or procedures shown.
Silicone oil, when injected for retinal purposes, can produce a closed angle glaucoma. The problem is we first remove the silicone oil, but we have to break the synechiae. Once we pull on the synechiae and break them, then we do the single pass 4-throw pupilloplasty. This is SOS, save our ships or save our soul, but in this case silicone oil synechiae glaucoma. The 4-throw pupilloplasty pulls the iris down so that the closed angle becomes open and the pressure is relieved. If we look at this particular case, there is a corneal haze, silicone oil is in the eye, and look at the anterior segment OCT shows peripheral anterior synechiae. We are scraping off the epithelium. We are checking on intraoperative gonioscopy, and that shows a closed angle. Now the first step in such cases is to remove the silicone oil. But let's understand, by just removing the silicone oil, the intraocular pressure does not come down. Here you can see, once the oil is removed, we are breaking the synechiae by pulling on the iris. Slight hyphema might occur, which will automatically get washed off with time. Now we pass the single pass 4-throw pupilloplasty, and in this we take a 10-0 proline suture. Let's see it on animation exactly how it is done. So you can use the suture there. From the other side, a paracentesis is used and a 26 or a 30 gauge needle is taken. The suture is then railroaded, single pass done, and the loop brought out. Then remember the number 4. 4 throws are passed, and that is game, set, and match. Because all you have to do is pull on either end, and that finishes the pupilloplasty. Normally you do a 3-2-2 or something like that. In this case, it's just done once, 4 times throw, and that's enough. The same can be done as many times as you want. If you look at the case again, you can see we have passed the needle, and from the other side a 30 gauge needle is taken through a paracentesis, railroad done, and then all we have to do is do the single pass. The loop is brought out through the paracentesis, 4 throws are passed through the loop, and the pupilloplasty completed. Micro scissors can be used to cut the ends of the suture. This is repeated on the other side and once more horizontally so that all the synechiae are broken. Once that is done, basically what we have done is we have made the closed angle into an open angle. That is what will relieve the intraocular pressure. You can see on intraoperative gonioscopy the open angle noticed very clearly. When you check the patient on an anterior segment OCT, you will realize immediately the post-operative picture shows an angle open. Another case of silicone oil synechiae glaucoma in which we have removed the oil, we are pulling on the iris, breaking the synechiae, doing the single pass 4-throw pupilloplasty, and you can see the preoperative picture and the postoperative anterior segment OCT and the clinical picture.